Safety and feasibility of modified chair yoga on functional outcome among elderly at risk for falls. This was printed in the International Journal of Yoga in 2012. Abstract. Falls are among the most common problems affecting older adults. At least 50% of those over the age of 80 fall annually. The goal of this pilot study was to assess the safety and feasibility of structured yoga in an elderly population with fall risk. Seniors at risk for falls were identified and enrolled in a single-arm pilot trial. A chair-based yoga program was provided twice a week for 8 weeks. The program was designed from previously published pilot data. A battery of validated instruments was administered at baseline and week 8 and was used to identify which instruments may be sensitive to change as a result of a yoga program. Among 16 seniors, median age of 88, with a previous history of falls, 87% provided data for assessment at the end of the intervention. 2 patients withdrew, 1 due to a fall outside of the institution, and the other due to lack of time and interest. There were no adverse effects during the yoga sessions. Paired t-tests compared pre- and post-changes and gains and were noted in fear of falling, and SPPB sit-to-stand subscale. Improved trends were noted in anxiety and the timed up-and-go assessments. We found the modified chair yoga program is safe and recruitment is feasible. Our data suggests that yoga may be beneficial in improving mobility and reducing fear of falling, which warrants additional research via randomized control trial. Introduction. Falls are a leading cause of fatal and non-fatal injuries in older adults. At least 50% of those over the age of 80 fall annually. Following a fall, an individual will present with increased fear of falling and a decrease in self-efficacy, often resulting in a sedentary lifestyle due to avoidance of activities that may lead to falling. Lack of exercise and daily activity leads to a decrease in balance proficiency, which has been identified as a key risk factor for falling. Physical activity and regular exercise have been shown to improve balance, prevent falls, and maintain physical function in older adults. Physical and social activity has been found to have emotional benefits, such as decreased fear of falling, increased confidence and independence in leaving their residence and partaking in more overall activity. Given the benefits resulting from daily exercise in older adults, it's crucial to find safe and effective forms of activity. Hatha yoga is a gentle form of exercise that has positive impact on physical, mental, and emotional well-being, and is also a promising intervention for managing fear of falling and improving balance in older adults. Research in this area is preliminary, with few studies investigating the correlation between yoga, improvement of balance, and the fear of falling in adults over the age of 65. In order to bring this intervention to assisted living environments where many older adults are at risk for falls, an understanding of the safety and feasibility is critically needed before launching larger scale research. Thus, our research aimed at assessing the safety and feasibility of a structured yoga program in an elderly population with fall risk. Materials and methods. Study patient population. The protocol for this study was approved by the Institutional Review Board of Richard Stockton College of New Jersey. Eligible participants were over 65 years of age from an assisted living community who experienced a fall in the past 6 months and an increased fear of falling as a result, had an increased risk of falls identified by the physical therapy or nursing staff, and gave written consent to adhere to all study procedures. Participants were excluded if they had a diagnosis of Alzheimer's disease and were unable to weight bear on upper extremities. Study intervention. This protocol was designed with mobility and balance concerns in mind. Thus, the yoga centered on asanas or postures that benefited the musculoskeletal system, mirrored from previous research in the use of yoga for osteoarthritis. The protocol includes particular asanas performed under the instruction of certified yoga instructors. Yoga classes met twice per week for 8 weeks at the assisted living facility. Residents participated in the yoga sessions from a chair and were given the appropriate props when indicated. Participants received 60 minutes of structured yoga, as shown, and yoga was the only intervention that participants received during the 8-week period for balance and fall reduction. The HADS anxiety subscale showed a reduction from baseline in fear of falling improved. These trends are encouraging and may point to improved confidence in participants' self-efficacy in activities of daily living. With these functional and psychological trends, less reliance on assisted devices for mobility in the community was noted. 3 participants were able to eliminate the use of their assisted devices completely. However, while improved trends were noted in the FR, the seniors on average were below 25 centimeters for FR at the completion of the yoga intervention, which indicates continued fall risk. Discussion. The preliminary research of a chair yoga-based program in an assisted living community among 80 to 90-year-old seniors is both feasible and safe. There is promising effects related to improved balance and mobility in this population that warrant additional research in randomized controlled trials. Ultimately, a critical examination of whether this intervention will prevent falls is needed to provide evidence for its integration into assisted living facilities and promote functional independence and healthy aging. The study duration deserves special attention since the FR scale indicated this population was still at fall risk. Future studies of greater than 8 weeks alongside a maintenance yoga-based program may be indicated to foster sustainability of gains made in the acute yoga intervention. A variety of studies have shown that exercise increases balance and QOL in seniors. This study offers chair-based yoga as a potential intervention to increase balance and self-efficacy as noted by the SPPB Sit to Stand Scale and FOF. Functional balance is an important characteristic as it represents the ability of the individual to complete activities of daily life. These may be measures that are of greater importance than those that measure stationary balance, such as the FR. There are several limitations to this study. The sample size of the pilot study was intended to develop the body of evidence to support further studies. The lack of a control group negates the ability to exclude the argument that the findings were caused by placebo, Hawthorne effects, or regression to the mean effect. It would be important to include a control group, utilize a larger sample size, and continue to develop sensitive measures that fit populations in assisted living communities. There are potential benefits of mind-body techniques on function as yoga and meditation involves an active attentional or mindfulness component. Research using Hatha Yoga to determine impact on cognitive function, fatigue, mood, and quality of life in seniors 65 to 85 years of age were randomized to yoga, exercise, and wait list control groups. The yoga intervention produced improvements in physical measures, as well as a number of quality of life measures related to sense of well-being, energy, and fatigue compared to controls. Our studies suggest yoga may be a safe intervention with potential functional benefit for those in their 80s and 90s. While the FR was difficult to administer to this population, it appears that the FOF and SBBP may be most sensitive to change in older seniors. Octogenarians and non-agenarians represent a growing sector of the population and are increasingly drawn to yoga. This presents both an extraordinary opportunity and a serious challenge for yoga instructors who must be both resources and guardians of safety for this uniquely vulnerable group. In any given class of seniors at this age level, various comorbidities and a diverse mix of abilities may be present. The majority will have at least one chronic health condition, and half will have at least two. In our study, each participant had an average 3 to 5 health issues that required concurrent management and use of several medications. Our yoga sessions were based on principles of the Therapeutic Yoga for Seniors program and fulfill a critical need to help yoga instructors work safely and effectively with this population coming to yoga classes, to provide a skillful framework for teaching yoga to seniors, specific principles of practice are important to ensure safety of this intervention. Conclusion. The pilot study is the first to demonstrate that yoga is a feasible and safe intervention for elderly seniors who may be at risk for falls in their 9th and 10th decades of life. A randomized clinical trial is needed to establish the definitive efficacy of yoga for objective functional improvement in seniors with fall risk.